Hello, everyone. It's Friday, May the 15th, and this is our briefing for today. Again, we're still continuing to lose some great West Virginians, and we have our 61st and 62nd death in the state. A 76-year-old female in Kanawha County and a 70-year-old male in Wayne County. I just wish to goodness in every way and pray in every way that some way, somehow, we'll be able to weather this storm. I feel very confidently that we will, but I absolutely know that these people need your prayers as well as all their loved ones. So please join Kathy and I in your prayers and thoughts for these families and individuals that these great West Virginians that we've lost. Also, we had a great loss also yesterday, with an unexpected National Guardsman, and it's Colonel Chris Nasser, was the Mission Support Group commander at the 167th Air Wing in Martinsburg. We lost him, as I understand, it's not on my notes, but we lost him to a sudden heart attack. And again, it's just too much tough news, but we got to find a way as tough West Virginians that are strong and faithful to be able to withstand these tough times. I'm confident beyond belief that the good Lord is not going to place upon us things that we can't handle. I've said to you over and over, I'm honored to be in this position. I'm not regretful to be in this position in any way. I'm very proud of what we've done and extremely proud of the West Virginians and all the good stuff that they've done. And I ask that you'll keep this National Guardsman as well as these other two people that we've lost in your thoughts and prayers, and join Kathy and I in that very, very much. Let me just go on and try to just touch on just a couple of things that keep coming up, and one part of me says, "Oh, just ignore the noise. It doesn't really matter," and it doesn't matter. It really doesn't matter. But on the other hand, you know me well enough to know that I'm not going to back away from an issue. I'm not going to ignore things, just for the sake of ignoring them when I think they can be detrimental to us. When it really boils right down to it, a question was asked not long ago, how do I make the decisions on what we do? And I went through, I first started with, prayer and calling on the good Lord to help us in every way. And then I went through all kinds of different steps, and primarily the steps centered around, after prayer, they centered around, your gut instincts, your knowledge of what you have done, and you've drawn upon that knowledge to be able to help through all this. But the number one players are our medical experts and our experts from the National Guard, or our experts from DMAPS or DHHR or whomever it may be. All the people we draw on is how we make decisions. Now, it's irritating as it can be to listen to people come up and say, well, the reason we opened the tanning beds is because we had a whole bunch of people that are complaining about the tanning beds not being open, or the reason we're going to open this and everything is because the governor's office is bombarded with calls and everything else. Well, first and foremost, I want to tell you just this, that I really believe a good governor is constantly talking to the people. I want to listen to the people and everything, and that's why I travel all over the state, or did travel all over the state, all the time, nonstop. That's why my vehicle's got 205,000 miles on it right now, and absolutely every mile in the state of West Virginia. You see, I truly believe that I should be listening to others. But if you believe for a second these decisions that have been made that have gotten us to where we've gotten to right now have been made by a bunch of noise about people complaining, you're just way out in left field. And that noise or that pressure is not going to influence a decision in any way. No possibility. Now, tied right with that, and I wish this stuff would just please quit, and it's just this, and I'm not going to get in a tennis match here, and start volleying back and forth, but I am absolutely not going to put this pandemic up with politics. I'm not going to do that. But yet it continues to surface. And really and truly, we're preying on those that just don't know the numbers or those that don't understand. And that's you, West Virginians. I mean, really and truly, when maybe the Democrats or maybe Senator Manchin came out and said, we ought to give $600 million, whether they need it or not, we ought to give $600 million to the counties and the cities right now, boom. And now the latest, greatest is, from the Dems in-house, now what we're saying, with the blessing of Senator Manchin again, we ought to give $600 million to all the small businesses. Well, somebody, pray tell, just do the math. I mean, somebody be prudent in everything in what we do. If we just do the math, we'd realize real fast, we've got $1.25 billion, and that would amount to $1.2 billion. Poof, and it's gone just that quick. And then what are we going to do at the state level? What are we going to do all over the place? There are so many aspects to making decisions and making them properly and making them timely. And we're still awaiting a lot of other guidance, in order to be able to do the things that we really want to do. And within West Virginia, I am trying to push our leaders in D.C. to the absolute fullest to be able for us to be able to backfill revenue and to do some things that will make our state and make our counties and cities whole. Now, that's what I'm trying to do. I'm trying to help our small businesses. I'm trying to help our counties. I'm trying to help our cities. And I don't need to apologize, nor will I apologize for anything whatsoever that is going on right there. Now, we'll make mistakes, sure. Sure, we'll make mistakes along the way, but my recommendation to Senator Manchin would be just real simple. And that's all there is to it. It's more politics that's going on in Washington. Joe needs to be in Washington. He needs to be pushing Nancy Pelosi to get out of the CARES Act and additional stimulus dollars that can come to the states. Get out. Why are we bargaining on climate change? Why are we bargaining on illegal immigrants? I mean, for crying out loud, does somebody not realize this pandemic is absolutely real and people are dying and the economics of it is absolutely just debilitating to all of us in every way? I mean, for crying out loud, do we really need to be debating or trying to slip in climate change or illegal immigration? And I mean, do we really need to be doing that? Why in the world, if we're really trying to do something right, why don't we just absolutely work to try to get as much dollars to West Virginia as we can get with the proper rules and guidelines that we can do something with it that will benefit all. Bottom line, if we can't stop the noise and the noise just goes on and, the next person wants to get up on a soapbox and preach and everything, let them preach. That's okay with me. But from my standpoint, that preaching hurts us. It hurts us. We have an opportunity in West Virginia to really do something here. And the more we just politicize this right here, the more it'll hurt. And the net of the whole thing is we have been together as West Virginians, and we have absolutely pulled the rope all the time. We didn't try to push the rope. We weren't divided. And look what you've done. Just look what you've done. You have done the greatest of the greatest of the greatest, and nobody can deny that. So I really wish to goodness that we could some way, somehow, just leave this politics stuff aside and deal with the fact that we're dealing with a pandemic that is the biggest event that any of us have ever dealt with or probably will ever deal with in our lives. So West Virginia, stay together. Please don't listen to the noise. Now, just a few announcements as quickly as I possibly can. The application for the cities and counties is, to apply for CARES Act monies is for all practical purposes done. We're reviewing and trying to make sure that there's not, just some inaccuracy here and there. We're testing in a lot of different ways and everything. I could tell you probably we're going to be up later today, but it really may be that what we want to do is hold that and either bring it Monday or bring it up over the weekend. We've also said that we were going to send out some information to the counties and to the cities. I want to get a little more detail on that and everything. And I want us to have more dialogue with the counties and the cities and everything. And we're going to surely do that. And then we'll be sending this out. And so look for that. I told you it'd be on Friday. For all practical purposes, we're done and we're ready to go. But we just want to make absolutely certain that we've got it as good as we can possibly have it. Just think about this just for a second. There's been a lot of people that have been out there as far as making applications to Workforce West Virginia, making applications, on their unemployment. And we've had a lot of people that were surely frustrated with, not being able to get through and calls, and we had to amp up the number of people, and then we tripled it, and then we tripled it again. Now just imagine and just think. In the state of West Virginia, we operate on an annual budget of about $4.6 billion. Now, just imagine, from mid-March through May the 12th, just on unemployment benefits, we have sent out $529,554. And can you just imagine the work that's gone in to send out $551 million in a month and a half? It is amazing. I know that we still got people that are still needing and wanting and frustrated, and to me, until every rock's turned, we're not done. But kudos to Scott Adkins and the National Guard and all their teams. You've done a lot of good work. Our testing for our minorities and vulnerable people, I want to remind you that all the residents of Berkeley, Jefferson, Mercer, and Raleigh counties today and tomorrow, that we're going to be open from 9 a.m. to 4 p.m. and testing in those locations, and additional testing, throughout all the rest of the counties in this state will follow. Those counties we wanted to start with first. I remind you that today is, Peace Officers Memorial Day. And I encourage us all to take time in prayer, or if you have an opportunity to talk, with anyone that's in law enforcement, to just tell them how much you appreciate them and how much that they mean to you, and just especially how much those we've lost, that we haven't forgotten them. I think back to our minority testing and everything, I just got a note and everything that thus far today we've tested in excess of 300 people. It's good stuff and everything, and all that's going along and working really well. So I would continue to encourage, Those people, if they would, please come in. If you have any anxieties whatsoever or any feelings that you're not feeling exactly right, come in and just get tested. Now, I'm not going to be able to pronounce these words, on this, but today there is a dreaded cancer that affects young kids, really young kids. Today, I am proclaiming that this Sunday, May the 17th, as DIPG Awareness Day in West Virginia. Now, you can read what DIPG stands for there, and I won't embarrass myself by messing it up, but basically what it is it is a cancer that affects young kids, and it is so rare, it's unbelievable. There's only probably 150 to 300 children in the United States each year that get this, but there's no known cure, and it is tragic beyond belief. And we had a beautiful 17-year-old young lady die, last year, and her name was Lindsay Varney, and she was a student at Princeton High School. I've coached lots and lots of basketball games at Princeton High School, and I'm in and out of the school, and I see those beautiful kids and the beautiful community, and it's just hard to imagine. So please just remember her. This is so rare. To draw a little awareness to this terrible killer, that we just hope and pray someday soon we'll have a cure, but today we don't. And we lost a beautiful, beautiful West Virginia kid. And so we're going to just make people aware all across this state and this great nation in any way we can, that we're not going to forget Lindsay and her family, and our prayers are with you every day. I guess the next to the last thing and is the fact that all of our gym clarification stuff should be up, and you can go to our website and all of our guidelines and stuff like that and see that, and I think as we continue, first and foremost, we've got to realize, let's just again, I only have one way to speak, and that's the truth. For the most part, everybody that has a business or whatever, it seems like today, everybody wants to be open, and what are you going to do? What are you going to do? We can't just drop a hammer and say, okay, everybody be open. Go do whatever you want to do. Because we know, and the medical experts tell me nonstop, we know what's going to happen if that happens, probably. And that is something really bad's going to happen. And we're going to be in a situation to where, now we're chasing our tail and trying to stop something that maybe we just didn't need to start. Now, we're going to try to reopen as fast as we possibly can in every way we possibly can, and watch. And at the end of the day, we're going to do it with the guidance of our medical experts more than anybody. Now, and so as we continue to open and everything, we're going to be watching and just be prepared. And be prepared that if absolutely we get blips on the screen that are absolutely not good, then we're going to slow down, or we're going to stop, or we're going to pull back. Now, and it may not be very tasteful from the standpoint of pulling back, but we're going to. If that be the case, we got to stop or slow down or pull back. Now, so with all that being said, we continue to try as best we possibly can on the guidance of those experts. We continue to address this really fluid situation. I'm telling you, there's no playbook here. Absolutely, there's no guarantee that any of us have it absolutely down pat. Now, it's hard to argue the numbers. And it's hard to argue how West Virginians have done, because you have absolutely knocked it out of the park. But as we go forward, we're going to have setbacks. We know we're going to have setbacks. That's why we have strike forces, and that's why we have additional testing capabilities and all the things we can do. But we know if we sit still, we're going to have an absolute meltdown. If we do nothing to try to combat this terrible villain, what's going to happen to us as a nation? Well, our nation will go broke. And if our nation goes broke, we're going to absolutely lose multiples and multiples of what we've lost. And so we've got to find a way to try to live with it, and that's what we're trying to do. I remind you again about the census. Don't forget the census, and the last of my last will be just this. Yesterday, we were at 2.08 as far as our cumulative percentage of positive tests. Today, we're at 2.03. Yesterday, we were at 1%. Absolutely, the number of active cases is dropping. The number of recovered cases continues to grow significantly. The number of our tests compared to our population and compared to the population of this whole country, we're testing way more. We're testing way more than our bordering states. We're absolutely at levels that these people would cry for. Now just stay with this just a second. Kentucky now has dropped down to 6%, and we're at 2. We're at 203 and they're at 603. We are at 1/3 of what Kentucky is. Kentucky is 3 times as bad as us. Now just think about it. Our nation is 4.5 times as bad as us. Pennsylvania is 10 times as bad as us. Maryland is 10 times as bad. Virginia is 8 times as bad, and Ohio is 5.5 times as bad. West Virginia, you have absolutely proven your merit. So just please, as you go out, as we continue to open, as we continue to give our citizens more and more freedoms that we all want, as we give our businesses the right and the ability to go back to work, as we give people the right to earn a living and to go back doing what they love to do in their work, absolutely, just please, just be cautious, be smart, and absolutely be West Virginians that I know you are, and everything's going to be just fine. Thank you so much.
All right, thank you, Governor. Now let's go to Major General Hoyer with the West Virginia National Guard.
Good afternoon. As Governor Justice pointed out, we lost unexpectedly West Virginia National Guard Lieutenant Colonel Chris Nasser, and on behalf of all members of the Guard, and I to pay particular respect to Chris's family and let them know that we have them in our thoughts and prayers. He spent 29 years in the National Guard in the 167th Airlift Wing and was a true patriot and a great West Virginian. Highlight a couple of things today. As the governor pointed out, we have significant testing going on. 55 National Guard personnel are supporting our public health and local public health partners. I want to pay particular tribute to Donnie Haynes and Tim Pretty from Public Health Office at the state level and the local health departments for the great work that they've done in coordinating these efforts across the state. As the governor pointed out, we have many more of these to do going forward. In addition to that, National Guard personnel are supporting local health department and assisted living facilities in Fairmont today. One other item of note, as the governor continues to press us on innovation and doing things going forward as we open back up. Yesterday, the West Virginia National Guard subject matter expert team working efforts with the school service personnel, hosted a Facebook Live event, and 4,200 people have participated or viewed that event. It covered virus basics, practices, and PPE, and health and service personnel for working with us to coordinate that. We will continue to do more of those as the governor presses us to do innovation and work to be able to open back up safely and effectively. Thank you.
Thank you, General. Now let's go to Scott Adkins, the Director of Workforce, West Virginia.
Good afternoon. First, let me say that the workforce team is keenly aware that there are several claims that need to be worked. We understand that there's a lot of still struggling West Virginia families that need those unemployment benefits. But as Governor Justice said earlier, he continues to press workforce to make sure that every eligible claim is paid as quickly as possible. Folks here at Workforce are working diligently around the clock to address all those issues. So if you continue to wait on your unemployment benefits, rest assured that Workforce is doing everything possible to make sure we get you those benefits as quickly as possible. I'll just hit a couple highlights. Governor Justice alluded to his opening remarks. Workforce has been able to process and pay out nearly or more than $500 million in unemployment compensation benefits. We have about 162,000 folks receiving regular unemployment benefits. We paid out more than 510,000 weeks of the extra $600 for more than $310 million of federal funding coming into West Virginia. I understand completely that if you're waiting for your benefits, that doesn't mean much to you. Continue to press Workforce. We're going to work hard as we can. If there's significant issues on your claim, be sure you let us know. If you get an email from us, be sure you respond. If you get a call, follow up with that call. We're going to get your benefits as quickly as possible. Thank you.
Thank you, Director. Now let's go to Dr. Clay Marsh, our coronavirus czar.
Well, good afternoon. I want to reemphasize something that the governor mentioned previously, is that we have done tremendously well as a state, and we're all very proud of the actions of all of our citizens in protecting themselves and their families, the vulnerable people of West Virginia, our healthcare workers in our state. But now that we're starting to reopen again, it's particularly important that people recognize that this virus is still out there. Most people in the state, given our very low positive rate, which is fantastic, but that means that very few people in the state will have any kind of immunity against the virus. And there was an article that came out yesterday that demonstrated that even normal talking in people who are infected with the virus can aerosolize the virus, and that aerosol, the droplets containing the virus, can last in the air for up to 14 minutes. And if you're forcibly talking loudly, yelling, singing, it can even create more droplets, and those droplets can be distributed, and that puts people at risk around those people. Certainly outside is better than inside, because outside the air currents diffuse that droplet spray. But that is really the reason why it's so vitally important that people really uptake the wearing of face masks and face covers. Face masks and face covers don't necessarily just protect you from other people who might be infected, who are spraying the droplets with the virus around you, but it really prevents you, if you would happen to have an infection without symptoms or maybe even the pre-symptomatic phase, it will keep you from spreading it to other people. So as all of us wear masks as we go out, or face covers, we not only protect ourselves, but we protect each other. And it's been shown in other countries that if we can do this to the 60% at minimum, but to the 75 to 80% optimally level, then we should be really good as we go out and come together again and enjoy the liberties and start up the economy. But it is so important, West Virginia, that you uptake this new guidance in a way that you can demonstrate the leadership for the rest of our country. And that's the way we'll keep our percent of positives low. We'll keep our children safe, our elderly safe, each other safe. and be a model for the rest of the country. So thank you very much.
All right, thank you, Dr. Marsh. Next, let's go to Secretary Bill Crouch with the West Virginia DHHR.
Good afternoon, everyone. Governor mentioned the testing we're doing. We're expanding testing as rapidly as we can. We provide just a little bit more data that just got a short time ago. Berkeley County, that testing site is at Martinsburg High School. We've tested 120 individuals in Berkeley County. Jefferson County, which is the testing site, is Asbury United Methodist Church. We've tested 137 individuals. In Mercer County, that testing site is at Bluefield State College at the Harris Jefferson Student Center, lower parking lot. We've only tested 36, so we would like to see those numbers go up. Testing is until 4 o'clock today. And in Raleigh County, we're testing at the Raleigh County Commission on Aging, and we've only tested 31 individuals. So please get out and test. You have until 4 o'clock. Identification is required, some sort of identification, driver's license or proof of address. And those under 18, again, will need to be accompanied by a parent or a legal guardian. No one will be turned away for testing. Our overriding goal here is to reach the minority population. So, but we will test everyone and anyone who comes by. So please try to get tested. Doctor's orders not necessary, nor an appointment. Just simply show up. Additional testing for Cabell, Kanawha, Marion, and Monongalia counties will be held on May 22nd and 23rd. We'll provide more information as we get closer to those dates in terms of the actual location of the testing. Fayette, Kanawha, Mineral counties will be tested on May 29th and May 30th. So we'll provide that information, testing information, as we get closer to those dates. The assisted living update, I have our server for that has been down, so I apologize. We do have 13 that were tested yesterday, so we know that number has gone up. I just don't have a current update for you for that. Of the numbers tested so far, of the individuals tested, we have 408 residents, all negative. 655 staff were negative. 4 staff were positive. Those individuals are being asked to self-quarantine. And then finally, we have Child Care Center update for you. We've tested 24% of the Child Care Center staff. We've tested 384 staff. We have 3 positives and 381 negatives. So those individuals are also being asked to self-quarantine. Child care centers are currently operating in 37 counties, and we have 16 health departments that have reported results for those child centers. So we'll try to give you these updates every day as we go forward. Thank you.
Thank you, Secretary. Dr. Kathy Slimp, our state health officer, is also joining us today and is available for questions. Once again, we're holding today's briefing with media members joining us virtually to practice good social distancing. The first questioner today is Mark Curtis with Nexstar Media.
Good afternoon, everyone. Mark Curtis from Nexstar Media. I think it's fair to say that you guys have done a good job communicating to West Virginians what they should and shouldn't be doing. I think the numbers reflect that. But it strikes me that this coming Thursday, the 21st, we may have a huge influx of people, thousands of tourists coming into West Virginia for Memorial Day weekend because whitewater rafting opens, Hatfield McCoy opens, restaurants can serve indoors again. I'm wondering what you're doing to get the message out to people from other states. Will there be state employees or National Guard troops at rest stops or entrances to the state to hand out lists of do's and don'ts and what the guidelines here, so they know what West Virginia is supposed to be and not be done here?
Well, Mark, first and foremost, the people that are coming, basically are our vendors then, and as they come, there are all these guidelines that are out there they have to follow. In addition to that, I know absolutely positively that the businesses themselves are sending out stuff nonstop to the people that are their customers that are looking to come, the possibility of coming and everything else. So there's all kinds of stuff that's going on, back and forth on that, and we're going to be observing and watching in every way that we can possibly do that, and continuing to have the dialogue and discussions, as updates on, are people complying? Are people, doing the right things? Are they social distancing? All the stuff that we've said over and over and over, and we're going to just be on top of it, and we're going to monitor it. That's what we're going to do to the very best of our abilities.
All right, thank you, Mark. Next, let's go to Charles Young with WV News.
Hi, this is Charles Young with WV News. I wanted to ask about the new methodology for identifying hotspot areas that was talked about yesterday. It was never mentioned whether or not the new system replaces the old system. What happens to the current list of hotspot counties? There's still several counties on that list. Are we starting from square one with that, with the new system, or how does that actually work?
I think Dr. Slimp is going to have to weigh in on that, or Dr. Marsh. I know they'll answer it better than I.
You're on mute, Kathy.
How's that working now? Super. Thanks so much. We certainly want to make sure there's a smooth transition between the two systems there. And so we are really working closely to align those. So I believe the governor will be addressing that on Monday as well. And we are really looking to make sure that any of the counties that are currently designated as hotspots are clear from the angle of the new criteria. And that need to move into the new system will do so smoothly. So we will work with folks to make sure that happens this weekend.
All right, thank you, Charles. Next, we'll go to Amanda Barron with WSAZ.
Hi, everyone. Hope you're having a good Friday. My question for you is about restaurants and the small businesses. We've been told by businesses their local health department gives the okay for outdoor patio seating, but then the ABCA comes in and says that they have to shut down if there are violations in some of the areas there because they don't meet the guidelines for outdoor dining. We've asked the ABCA for guidelines, but we haven't received them. Can you tell us what they are or clarify what standards need to be met for outdoor dining?
Okay, I think Secretary Crouch, maybe you could answer that.
Yes, sir, Governor. Hi, Amanda. Thank you for the question. Those guidelines are on the governor's website under small businesses. The way we're looking at this is like we're looking at most of these in terms of distancing and personal hygiene, but also having sanitation stations, monitoring employees with regard to their temperature and their history if they've had contact with someone who's positive. So that is all. Signage is important. Again, there are a variety of things on the website that anyone can look up on that. Be happy to pass that link to you later if you like.
All right, thank you, Amanda. Next, we'll go to Phil Kabler with the Charleston Gazette-Mail.
Hello, everyone. Governor, as we're proceeding to reopen tanning salons, whitewater rafting, various businesses, isn't it time to reopen these briefings and allow reporters back into the participate in person and eliminate some of these artificial impediments that are imposed on reporters at the moment?
Well, Phil, I hope to the Lord above you don't think there's been an artificial impediment imposed upon you and everything, because I don't know how in the world we could be more transparent in what we're doing, but nevertheless, I don't even know how to answer that, to tell you the truth. I'm sure an open book, and I have no problem with people being around, but in this room right now with the technicians and everybody that's here right now, there's probably close to 10 people here right now, and the room's not all that big. And so if we got another 15 or 20 media people in here and everything, it could turn into a situation that we wouldn't want it to be.
All right, thanks, Phil. Next, we'll go to Brad McElhenney with West Virginia Metro News.
Hi, Governor. Hi, everyone. Governor, hope you're doing okay today. I get your point that the coronavirus precautions and the economic response are a great responsibility. But we do have an election coming up in just a few weeks, which is important also. And it's important for voters to know what their choices are to make informed decisions. So that said, I wonder if you intend to debate your opponents in that election.
Well, I don't really know, Brad. To be perfectly honest, I hate to say it, but we've just not done much work, in regard to the campaign stuff. I've got a headquarters downtown. I've never been there. I just haven't done any work as far as the campaign. I know our campaign's putting out some commercials, and and I know they're working every day. I've had very, very little dialogue with them and everything. And like I said over and over and over, whether you like to hear it or you don't like to hear it, my job right now is this pandemic and looking out for West Virginia. That's what I'm going to do.
All right, thanks, Brad. Next, we'll go to Leslie Rubin with WCHS and WVAH.
Hi, Leslie Rubin here with WCHS. As of this morning, there had been 118 tests administered across the state's correctional facilities. That's about 1% of the population. Is that number good enough? And are there any plans to do mass testing, especially in jails where inmates are coming and going more frequently? And along those same lines, the DCR has said previously that staff and correctional officers are not being tested by the state and instead they need to go elsewhere. Why is that not a priority?
Well, I'll let our medical people jump in. I'd like to lead off, though, and say just this. As far as I'm concerned, your question is the testing enough? And I would say it's never enough. Really and truly, we're 118 to 0 right now. That looks pretty dadgum good, and that would, indicate that we've surely got areas that we need to test more, but we all know the amount of testing capabilities that we have is somewhat restricted, and we're trying to grow that more and more each and every day. And so I would just, I would now, pass off, maybe our medical team can add more to it than I've got there.
Clay has some, we've had some, this is Bill Crouch. We have had some discussions regarding correctional facilities and our institutions such as psychiatric facilities and others. We're constantly looking at that list and trying to juggle. We would like to test everyone, and again, we're picking up our testing drastically. We're getting close to 4% for the state, which is terrific with regard to comparison to other states. It still doesn't give us a prevalence number in terms of the degree that this disease is throughout West Virginia. So should we test more? Absolutely. Are we trying to test more? Absolutely. But we certainly think correctional facilities are an area that we've got to constantly monitor, and we are juggling that priority list. We wanted to move to the African American population and the minority population and the assisted living population in terms of our vulnerable population. So those are all important. We do have a list of those correctional priorities. Correctional facilities are on those, and we agree it's a priority.
All right, thank you, Leslie. Next, we'll go to Steve Adams with Ogden Newspapers.
Yes, Steve Adams with Ogden Newspapers here. This is a question for Scott Atkins with Workforce. Do we have our unemployment numbers yet for the state? I know they should be coming out here relatively soon. I know last month, I believe it was somewhere in the 6% range for seasonally adjusted unemployment. I think it's probably safe to say that number has gone up substantially. I wanted to know if that number was coming out later today or beginning of next week, or if you had it. Thank you.
Yeah, good question, Stephen. We get that question quite frequently here, and you're right to say it has gone up. Those numbers will be released on the 19th, which is next week. I don't have them with me, but I can assure you that it's going to probably more than double what we saw last month. But those numbers will be released on the 19th.
All right, thank you, Steve. Next, we'll go to Annie Moore with WVVA.
Hi, Governor. Have you given any more thought to requiring specific counties to report their active versus recovered numbers, give people a better idea of the threat level?
Bill, did you hear her question, or Dr. Slim? You know, basically, I think she's saying, you know, do we have it on as far as the recovered versus the active? Do we have it on a county by county level? And I think we do, but I don't. You know, that's maybe for you guys to answer.
Yes, Governor. I think Kathy has some more information on that than I do, actually.
I'd be happy to talk to that. We actually are now getting even better data than we've ever had before in terms of recovery definitions and things. And so we are working to actively begin to show that on a smaller level, on a county level with that as well. So that's going to be a really important shift and that we will anticipate seeing shortly. So I think we've got new ways of looking at that, and it's really important to look at it both statewide and in the community level. So yeah, it's a great question. I really appreciate it.
All right, thank you, Annie. Next, we'll go to Paul Mullen with WCBC Radio.
Good afternoon, Governor. A business question for you. You can open the doors, but you have to do enough business to keep the doors open. Because of the limitations and people afraid to go out and things like that, the dynamics have changed. Are there any programs being considered to help businesses get over that hump?
Paul, let me take just a second to comment on this, okay? Right now, there is a proposal by the House in D.C. right now to pump another $3 trillion into a stimulus package in addition to what's already out there. I don't think that'll pass. But at the same time, I think some version of something has to pass. Because, Paul, here's my take on the whole thing. Just opening a certain amount of businesses, or if we were even fortunate enough to be able to open all of our businesses, there's a lot of people that aren't going to go today. And a lot of businesses have already suffered a fatal blow to where they may not be able to recover today if they were allowed to be able to recover today or open today. The net of the whole thing is there are barriers that are standing in the way of the success and the economics of our businesses that absolutely will require, in my opinion, significant more participation from our federal government to get us through this. You know, in all honesty, it is a really tough deal. And the balancing act, you know, now you're talking to a business guy. The balancing act is really, really tough. At the end of the day, we know there's going to be significant bumps still in this road. And really and truly, we also know that a restaurant can't really operate on a 50% capacity and make ends meet. So what's going to happen to that restaurant? At some point in time, if something doesn't give and something doesn't change, that restaurant is going to fold. And when that restaurant folds, individuals lose their jobs and everything, and the country slows. Absolutely, there has to be. If you're wanting a truthful answer from me, there has to be additional participation from the federal government because we are not over this. Now, do I want participation to the tune of Nancy Pelosi throwing money just in every direction known to man? I mean, it's so irresponsible, it makes me sick. But to the good business, to that good restaurant that I just spoke of, those people will need our help. And absolutely, we've got to absolutely navigate through the wickets to be able to help those businesses or we'll lose them. So, Paul, your question is a great, great question. And as we go forward, and what I've said so many times, you know, there are people within the D.C. area that really thought maybe we could just go back over and turn the switch and this thing would just crank back up. And all of a sudden what we did is we strolled over and cranked the switch and she didn't start. And that's the magnitude of this problem. This problem is enormous. And absolutely, to get the engine started, it's going to take a lot of doing between now and when that engine really starts. And the only way the engine is going to start for good is a vaccine. So that's surely a very, very truthful answer on my part.
All right, thank you, Paul. We have time for one more. We'll go to Taylor Stuck with the Herald-Dispatch.
Hi, Governor. It's Taylor at the Herald-Dispatch. I've heard that state workers may be heading back to the office on Monday, so I was wondering if that was true and who all is heading back and kind of what are the guidelines for offices to open back up.
Taylor, I do not think that the state workers are heading back into their offices on Monday. Some possibly, but not many. And and we're still working on that, and we're still encouraging people that they can do the work from home to work from home, and we're still working with all the details out on that.
All right, thanks, Taylor. Governor, I'll turn it back to you.
The only thing I guess I'd add is just this. I mentioned to you earlier we had tested 300, with the minority groups or the vulnerable people, the more vulnerable people, and now it just kind of came up just a second ago. It's about noontime or a little past noontime, and now we've tested 524 people so far today. Good stuff. A lot of people out there on the front lines working and working really well, and so that'll give us just more and more good data as we go forward. The only thing I would tell you is just this, and whether it be, wouldn't it be better from a standpoint of the media if we had everybody, all around the table here and in the room? Wouldn't it be better if we could just wave a wand and send 600 million here and 600 million there? Or wouldn't it be better if we could just find an absolute solution to where that restaurant owner, we could do something about that 50% capacity? There's 1 billion of these questions. There's 1 billion of them. And we should keep our eye on this ball. And that is, we're 2.03. We've got 62 deaths so far in the state of West Virginia. We're absolutely trying to navigate the stormiest sea in the history of all time. We absolutely don't need to get distracted, West Virginia, and start pulling ourselves in different factions. If we do that, this thing's going to come unraveled and we're going to hurt ourselves. So West Virginia, stay the course. Keep on doing the great stuff you're already doing. You got a lot of people behind the scenes that are doing great work, and the numbers show it. So let's just keep at it, West Virginia, and let's don't get distracted on, let's surely don't get distracted on the stuff that is halfway, none of it is small, but at the same time, if we get distracted on something, we're going to miss something. We need to stay focused on how do we get that restaurant owner profitable and going. And the way we get the restaurant owner profitable and going is we absolutely keep our numbers where they're at, and we keep producing good numbers, and we're able to do more and more and more. And the last thing is just this, there's everybody has an opinion, and for crying out loud, we want to be respectful of all those opinions, and we want to listen, and we want to learn and recruit more and more and more knowledge. But just the idea of somebody just coming out and saying, well, let's just take this money and let's do this and let's do this and let's do this and everything else, when really and truly, the mathematics just won't work, or the guidelines are not even in, or the idea that, sure, it's inconvenient that we don't have the press all in here. Sure it is. Sure we have an election coming up and everything, and sure there are issues, but for gosh sakes 11, We have an absolute pandemic to still deal with. We have an economic meltdown of this whole nation to deal with. I mean, can we not try as best we can to keep our focus on the ball and just stay eyes on the ball? Thank y'all so much.